This is kind of our inaugural meeting for the IBD TIE, which is Treatment Idea Exchange. And right now we don't have a specific agenda. That's why we're looking at social media and different things like that, because we want to get part of the agenda from the people who are out there. The basic goal of this organization is to discuss ideas that maybe you're not getting in your doctor's office. Not that the doctors who are taking care of you folks are not well-meaning, well-intended, and don't have your best interests at heart, but there are a vast amount of idea and information out there that perhaps are not getting through because it sort of falls to the left of center. And one of the first things we're going to talk about is that of diet. It's not the only thing we're going to talk about in diet. We were just having this conversation before we kicked off the meeting that we don't want to overstate the importance of diet, but on the other hand, to understate it would be woefully inadequate, because it is a valuable tool to trying to get health when it comes to GI disease in general and IBD in particular. So that's kind of where we were thinking. Actually, the idea for this whole group is something that was rolling in the back of my head, but it's actually patients of mine who are behind you, these lovely ladies, who really have done a lot of the legwork to try to put this together, because it was through the exchange of information that their disease was greatly impacted for the better. And they feel much better now. I don't want to speak for you guys, but I guess since they took the initiative to put this together, that I'm assuming that they're feeling much better with the introduction of some of these ideas. So today we're going to talk about diet, and you're seeing here the Paleo Diet. Are you guys familiar with the Paleo? Or is this completely? Show of hands. Anybody? So most people are familiar with the Paleo. Paleo stands for old, and Paleolithic, old stone. So another way of putting this is the Stone Age diet. What I would like to sometimes refer to as a primitive diet, or what we think that people many moons ago ate. So we take diet and we distill it to its most basic essence. And as you can see from that little flow sheet, which is kind of tongue-in-cheek, but I like it, what is paleo? It's basically meats, fish, poultry, everything, all that falls under the rubric of meat, fruits, vegetables, with a spattering of nuts. What's not on the diet? There are no starches, there are no grains. Now, if you watch TV in the evening, which I know you do not, if you watch TV in the evening, there's about a bazillion commercials about whole grains. So people are getting a lot of mixed messages here about nutrition, but I'm right and they're wrong. So that makes it But no, there's good reason why we jettison grains in this diet, and it's not of my construction, although I've been a fan of this program for well over a decade now, and I have seen its work in the clinical practice. The reason why grains are jettisoned is because in grains there are proteins that sometimes can be stimulatory to the immune system. Now, there's a word that most people maybe 5 years ago didn't know existed, but now it's kind of the fad thing, that being gluten. Everybody's gluten-free, and they think that that's the ticket to hell, ticket to Disneyland, and everything in between. Gluten is just one type of protein that exists, and it's a common one. It's a one that many people are sensitive to, but it's not the only protein in grains. There are different proteins in everything from rice and to corn, with the gluten-containing grains being oats, barley, and rye, being perhaps the most problematic. So when you're already having a condition like inflammatory bowel disease, where the immune system is already stimulated, by throwing more stimulus in the package is not a good thing. And so that's why grains are jettisoned. The other thing is it looks at starch content. And the reason why starch is important, content's important, is for two reasons. One is insulin levels. As you raise the amount of starch and sugars in the diet, insulin levels go up. Now, everybody's familiar with insulin, right? And what is the role of insulin? Well, just speak up, don't be afraid. It's not a test, you're not being graded. What is the role of insulin, as most people would know it?
Regulate blood sugar levels.
Right, that's the primary role of insulin. But insulin, the body is constructed that it's pretty rare that you'll have something as important as insulin have only one job. They're multitaskers. And the other job of insulin that's very important is the control of inflammation. So yeah, we forgot to mention that one, right? Where was Dr. Oz on that one? Right? So as we raise insulin levels, there's a whole cascade of inflammatory markers that also are increased. And so what's happening in inflammatory bowel disease? It's inflammation. So one of the ways we lower inflammation is by lowering insulin levels. And the way you lower insulin levels is through the reduction of starches and grains in the diet. So that's another reason. A little bit of a more obscure reason is the gut flora, the bacteria. Now that's another buzzword that 5-6 years ago, no one, probiotic, ubawada, but everybody now is talking about probiotics and even Centrum vitamins, who spend more on advertisement than in their products, has now even gotten into the whole probiotic scene. The bacteria in your gut, they're living organisms. What do you think they live on? Sugars and some of the undigested material that goes through our GI tract. So by reducing, again, some of this carbohydrate content in grains and starches, we are restricting the amount of growth of certain bacteria in the gut. And again, there are other theories out there that suggest that there is a very strong connection between the bacteria that live in the gut and inflammatory bowel disease, especially, and I think even more so in ulcerative colitis than in Crohn's disease. And these things, we're not going to be able to cover everything tonight, and actually leaving you with some questions is a good thing, because then maybe you'll come back next time. So, but that's part of the other concept. The other thing about the paleo diet is it helps one other component. It helps raise what are called the omega-3 fats and lower omega-6 fats. Again, they got half the story. Again, you can't watch TV in the evening, which I know you don't do, where they're not advertising omega-3 fats of some, fish oil, krill oil, and this is important. But the other side of the story that they don't talk about is lowering the counterpoint to omega-3, which are omega-6s. And again, we can probably spend a whole lecture. Actually, if you wind me up, I can probably talk a couple of hours on just omega-3 and omega-6s. But omega-3 tend to be anti-inflammatory, whereas omega-6 tend to be pro-inflammatory. And you need both. I mean, if you bump your leg, you want some inflammation, but you don't want too much. So it's about a balance. And when we take a few fish oil, if you're not reducing the omega-6s, those few fish oil are going to do little to nothing. And guess where we find a lot of omega-6s? Grains and starches. The primary source is vegetable oil, corn oil, and other grain sources. So again, you can take a lot of omega-3, but if you're not also reducing an intake of omega-6s, you're not going to have the full benefit. And omega-3, as I said again, is anti-inflammatory. So basically, when I talk about the paleo diet, there are things to emphasize. It emphasizes anti-inflammation, which again, if you have inflammatory bowel disease, that's what you want. You want to be blocking inflammation. It is also low. There's a little big word. It's low antigenicity, meaning that means those proteins that stimulate our immune system are lowered in this diet. So we were talking about gluten being one example, and the third is it's friendly to the gut bacteria. So it helps reestablish the gut flora to a more friendly gut flora. And it is our belief that all three of those components can have significant benefits for everybody, whether you have inflammatory bowel disease or not. This is not just generic to one population group, but it's very important, I think, if you have GI disorders. And again, I've been doing this for a long time, and I've seen time and time again how people, once they go on this diet, they're really surprised. And actually, over the last few years, I've been getting referrals within the group from the doctors sending me patients within the group to talk about diet, and we've had some really miraculous results. But anyway, that's the science, and that's a real nutshell of paleo. But how do you make paleo work in your life? In my opinion, you just cook up a steak and steam some vegetables, and that's good enough for me. But that's not good enough for everybody. So I'm going to introduce Lori, who is one of my patients who has triumphed with paleo, and I'm going to let her tell her story a little bit, and how a mother, a wife, how that they can make paleo work in their lifestyle. And let's hear what I'm going to shut up and let you talk.
All right, so most of you, all of you actually know me, but as Dr. Brasco said, my name is Lori, and he's given you the science behind the diet, so now I want to give you a patient's perspective. I wanted to start out by giving you a brief history of my illness, and I do this not because I'm trying to gain your sympathy, but because you need to understand how this diet has really impacted my life. Doctors have never been able to say with 100% certainty what disease I'm exactly dealing with. I was originally diagnosed with ulcerative colitis, but now we're sort of leaning more towards Crohn's. My troubles began about 15 years ago when I was 15 years old. And like I said, I was diagnosed with ulcerative colitis, and I was told it just affects the first third of your colon, you'll be fine, here's a pill, you can go live your life as normal. Well, I took that pill, and then I took other pills, and my disease was unresponsive. So within 1 short month, the disease has eaten its way through my entire large intestine, my colon perforated, and I had emergency surgery to have it removed. That was the first of 11 surgeries, and the beginning of a 2-year-long period where I was battling for my health and at times for my very life. On and off throughout those 2 years, I had a temporary ostomy, but in the end, using my small intestines, doctors were able to fashion an internal continent pouch called a J pouch, which sort of replaces what the lower part of my colon did. For the next 13 years, although I took about 6 Imodium AD a day and still had chronic diarrhea and averaged at least 1 hospitalization a year, I managed to go on and have a semblance of a normal life. I went to college, got a degree, came home, got a job, got married, bought a house. Well, 2 years ago, my husband and I were surprised and blessed with the miraculous pregnancy that resulted in the birth of my daughter. After the pregnancy, however, the symptoms of my disease escalated to a point where I often felt like a captive in my own home. I couldn't leave the house, and there were several days where I was so ill and in so much pain that I couldn't properly care for my baby, and people had to come over and help me. I'm not exaggerating when I say I had 25 plus bowel movements a day. I had a baby that slept 11 hours a night, but I couldn't sleep more than an hour at a time because of all the bathroom trips. As you can imagine, with that sort of frequency comes all sorts of pain, discomfort, irritation, and just overall misery, not to mention embarrassment. I endured that for about 9 months, and then I was referred to a new doctor who, upon meeting, I said, if you can't help me, I'm going to the Cleveland Clinic and I'm getting a permanent ostomy because I can't live like this anymore. It was then that I was first introduced to the Paleo Diet.